My name's Dr. Gill.
Hello.
It'd be nice to have a conversation with you today to do an examination of your mental state.
Okay.
So that's going to be having a look at your thoughts at this moment in time.
Okay.
Before we start, can I please confirm your name and date of birth?
Yeah, of course. It's Yanni Nazareno, 30 September 1996.
Okay, thank you. So, just to clarify, this differs from the history that was taken before. This is looking at how your mind is working right now in the room. Okay, we will ask some questions that might seem a little bit bizarre, but they are asked to everybody. Okay, so to start off, could you describe your mood today?
I think it's okay.
Okay, and if we were to ask, a friend or a family member, how do you think they would describe your mood?
I'm not really sure how they would describe me. I think they would probably find that I'm mostly probably a hindrance or like in the way, but I think mood-wise, maybe probably a bit of an overthinker. I don't know if that is a mood. I'm sorry.
An overthinker. Okay. And so you've said that you think your mood's okay, but you've said that other people might describe you differently. Do you think that's reasonable?
Perhaps. I'm not really sure. Maybe I do overthink quite a bit sometimes.
Okay. You say that you do overthink. Are there things that you spend a lot of time thinking about?
Can you just repeat that question again?
Yes. So you've said that they think that you perhaps might be an overthinker.
Yes.
Are there particular thoughts that go round and round in your head?
I think it's maybe it doesn't seem too rational. Probably it seems I always think I'm sort of getting in the way of people, or I'm not doing things right all the time. Just normal things like that, I suppose.
Okay. So are they things that you're worrying about?
I do worry about it quite a lot. So I don't really like to be a nuisance to other people. Yeah.
Are there any thoughts going through your head, round and round at the moment?
I just hope that I'm not wasting your time, assessing me. I think I'm fine, really, but...
Okay, well, don't worry about that. Do you have any fears?
Probably, like, being isolated by people, I suppose.
I see. And sometimes people have fears that will mean they are forced to take certain actions. Does that apply to yourself, do you think?
Sorry, can you just repeat that question again?
So sometimes when people have fears, it can lead them to being forced to perform certain actions.
Yes.
So for example, somebody thinking that they keep on leaving the front door unlocked, they'll go back to check the door is locked several times, even though each time they find it's locked.
Yes, yeah, I find I do that quite a lot. I have to make sure that I haven't left the oven on, or I haven't let the cat out or anything like that. Yeah.
Okay. I'm going to specifically ask some thoughts now about your mind. Now, some of those thoughts might seem a bit strange, but we do ask them to everybody. Yeah. To start off, have you had any thoughts that you might have special powers?
I wish, but no.
Okay. Have you had any thoughts that people might be doing or saying things that had a particular significance to yourself?
I suppose I think people might be saying bad things about me. I'm not, yeah.
Okay, so you say about that. Have you had thoughts that people might be trying to hurt you?
No, nothing like that.
Okay, and a final one on those questions. Do you ever feel that you could be controlled by an outside force?
No, I don't think so.
Okay, staying with thoughts, again, we ask them to everybody. Have you ever thought that anybody could read your thoughts?
No, nothing like that.
Okay, could anybody put thoughts into your head?
No.
Okay, and would it be possible for someone to take thoughts out of your head?
I wish sometimes, But no.
So you say you wish that they could. What thoughts would you like to come out?
I think just people thinking badly about me and everything I do. I just feel like I'm in the way most of the times, everywhere I go and everything I do.
That sounds very troubling. Can I stay with that and just ask you a very difficult question? Have you had any thoughts about hurting yourself?
Hurting myself, I haven't done any self-harm or anything, but sometimes I do think
Okay.
possibly about it.
Have you had any thoughts that you'd be better off dead?
Yes, I do think like that sometimes.
Okay.
Yeah.
Have you ever made plans to act on that?
No, not at the moment.
And have you ever acted on those thoughts?
No.
Good.
No.
What things would stop you acting out those thoughts? What protective factors have you got?
I suppose my cat, he kind of calms me down sometimes, just stops me from thinking things, so I wouldn't want to leave him. I don't have anyone else that could look after him.
Okay, that's fair. Now, thinking about other people, have you had thoughts that you might want to hurt others?
Oh, no.
Good,
No,
good, thank you.
definitely not.
We've talked about your thoughts, but I'm now going to talk about perceptions and the way that you see the world. Have you ever had what we might term a misperception, where you've seen something and actually you've seen it differently from somebody else? So, for example, they see a rope on the floor and you actually see a snake.
No, I don't think so. No,
Good.
nothing like that.
Okay. Have you seen things before that other people haven't been able to see?
I'm not sure. I don't think so.
Okay.
Not that
And have you ever heard things that other people haven't been able to hear?
I don't think so. I think,
Good.
yes.
Have you ever heard your thoughts spoken out loud as if by somebody else?
No, I don't think so.
Good, good.
Yeah.
That's very positive, thank you. Staying with that, the perceptions, have you ever had the feeling that you might not be real?
No.
Good,
No.
good. I'd like to look into how your memory is working at the moment.
Yeah.
So, can you just tell me the day today? What day of the week is it?
Oh, goodness. Today is Wednesday.
Okay.
Yes.
And what date is it?
It's January, I think 28th,
Okay, and what year is that?
2026.
Thank you. And which hospital are we in at the moment?
In Warwick?
Super, thank you very much. Can you tell me what you had for dinner yesterday?
Mashy peas.
Thank you. Can you tell me who is the President of the United States?
Oh, I think I know this one. I think it's Trump.
Thank you. So I'm going to give you 3 words to remember. Ball, cat and table. We're going to come back to those in a minute, but can you repeat those to me at the minute?
It's ball, cat, and table.
Okay. I'd now like you to spell the word world for me, but spell it backwards.
Okay. D L R O and W.
Fantastic, thank you for that. So I've just asked you to remember 3 words. What were those?
I think toy, cat, ball.
Okay, thank you. So, what's your understanding of why you've come here today?
I'm not sure. I think the doctor thought that it might have been a good idea. I just don't want to waste people's times. That's all. So I'm not really sure why we're doing this, but the doctor seemed to think it was helpful that I go through this.
Okay. So that completes the questions that I've got for you today. I would, however, like to do some additional tests.
Okay.
I'd like to do a blood test to have a look to see if we can find any problems, perhaps with your thyroid, any signs of issues with your full blood count, your liver and kidneys. I think it also might be worthwhile to do a urinalysis to see if there's anything abnormal in there. Do you have any additional questions for me on that?
No, just thank you for your patience.
Super, thank you very much for your time. So in terms of completing the mental state examination, the patient here had a normal appearance. They appeared to be well kempt. They appeared to be dressed appropriate for the setting and appropriate for the weather. In terms of behaviour, they were able to maintain brief episodes of eye contact throughout the consultation, but they would certainly look away for a large amount. They had a relatively closed body position with their arms crossed over their body, and there was an element, quite an element of psychomotor agitation. We've got juddering to the legs, playing with the skin, and excess movements at times. In terms of the speech was fluent. There were some occasional pauses, and we had a low volume with a slight shaking as well to the tone, again in keeping with a presumption of anxiety. There was no obvious paucity of thought or difficulty speaking, no night's move thinking or clang associations, no neologisms or abnormal words. In terms of our assessment with regard to thoughts, there were some overvalued ideas sounding towards obsessions, where the patient may have to check that they let the cat out several times, which were compounded by the compulsion to go and confirm that the cat, or the door as I'd also said, had been closed. There were no other obvious thought form disorders in terms of delusions. There were no abnormal perceptions nor hallucinations. In terms of the cognitive assessment, the patient was orientated in time, place and person. They had a good attention span. They had, in terms of being able to spell world backwards, they had good long-term memory. They had memory recall for recent events. And I had no concerns about cognition, although there was a slight dropping of remembering one of the 3 words. Overall, I would suggest that this mental state examination, which would need to be combined with a history, or maybe in keeping with a patient with anxiety.